49-year-old Brian Chow, not his real name, tells us that in his adult life, he has been diligent in going for his health checkups.
If you are able, this is an exercise that you should do at least once a year. Because what I can say is that no one is safe from such an occurrence.
It is until last year, during his routine visit to the doctor, that he realized his prostate-specific antigen was higher than normal, which raised an alarm.
And then first, we suspected prostatitis. That is, it's supposed to be an infection. He put me on antibiotics for, I think, for a bigger part of last year. And the PET scan was not very clear either that something exists. So the worry remained there because the PSA still was not behaving, because it's supposed to be a maximum of 4. And mine was reading 9. It went up to a high of 9.1.
And after hundreds of tests, with some seeming to have cancer traces, Brian sought for immediate intervention at the Nairobi hospital.
I went in yesterday at around 3 p.m. And to be very honest, I can't say what happened because, you know, they put you under anesthesia. And when I woke up, everything was just normal. I didn't feel anything until now. As you see me here, there's nothing that I feel nothing. There's nothing. I cannot say that it's painful or everything is fine because I'm passing urine just okay.
Unlike the past, where cancer treatment involved invasive surgical procedures which called for radically removing the prostate, Brian is among hundreds of patients who have received the new advanced brachytherapy treatment.
It is a radiotherapy in which you implant the radiotherapy inside the disease rather than treating it with external beams shining into the prostate. You can even move forward and identify parts of the prostate where this disease is the next frontier, and you put the seeds only where the cancer is. In other words, the prostate remains intact and there is no major surgery that is going to take place.
Dr. Peter Mungai Ngugi tells us that compared to the traditional cancer treatment, this technique has seen 99% success treatment, even as Brian confirms of his experience 24 hours after his procedure.
When I woke up, everything was just normal. I didn't feel anything until now. As you see me here, there's nothing that I feel nothing. There's nothing. I cannot say that it's painful or everything is fine because I'm passing urine just okay. My body is just fine. I've had my breakfast very well, and I'm just waiting to go home. I'm going for a meeting, yes. I'm going back to work because nothing is barring. Even the doctor has told me, you go back to your normal duty.
Kenya is the only country in the sub-Saharan Africa that is offering this model of treatment, offering relief to hundreds of Kenyans who seek treatment outside the country.
Those early tumor patients can be treated well with brachytherapy, very effective. And from the start in 2017 until then, more than 100 patients have been done here, and the technique increased significantly. The quality of the technique increased significantly.
Cancer is the second leading cause of death from non-communicable diseases. However, doctors say that diagnosis of cancer can be devastating, but when diagnosed early, it can be managed and a lot prevented. The advancement and technology in the health industry has enabled treatment of many diseases, including cancer, which is the leading cause of death in the world. And now, with the new technology of prostate cancer, now many Kenyans can get this treatment without having to travel to different countries to seek for these services. Robbie Omondi, K24, Nairobi.